Hello my friends and welcome back. You asked me to do a self-massage for TMJD, temporomandibular joint dysfunction. So if you have a tight jaw, achy jaw, anything like that, this is going to be a great video for you. So you want to start out with clean hands because we'll be touching our faces. So if they're not clean, pause the video, go wash, come on back. And we'll start with just some nice deep breathing because a lot of jaw problems are exacerbated with anxiety. We tend to clench when we're stressed out or anxious, right? So just have a nice seat, sit up nice and tall but relaxed, and try to breathe in through the nose and out through the nose. So take a nice deep belly breath. You can put your hand on your belly if you'd like to feel it inflate. And a long breath out. Make sure you empty out all the air before taking a new breath in. And start to play with elongating the inhale and the exhale. So a nice slow inhale through the nose. Take your time, fill up. And an even longer exhale out. Take your time. Already you feel that tension sort of oozing out, right? We'll do one more. Nice deep in, deep out. Long exhale. Wonderful. And we'll start with just a relaxed position of the jaw. Most of us don't carry our jaws in a relaxed position. We kind of clench it up. You want your top and bottom teeth separated, right? So they're not clenching, they're just a little separated. Your mouth can be closed. And you want the tip of your tongue behind your top two front teeth, just resting very subtly on the roof of the mouth behind your top front teeth. I know it's a little weird, but that is the relaxed position for the jaw. So go ahead and just rest your tip of your tongue up there. Teeth apart. You can close your mouth, but keep that jaw relaxed and just take a nice breath like that. See what that feels like. And we'll start right on the joint lightly because it's a delicate little joint. So right in front of the ear here, if you clench your teeth or bite, you'll feel it pop out. That's your TMJ, temporomandibular joint. We'll just start with little circles. I'm just taking my fingers and just doing gentle little circles. And that should feel really nice. Absolutely no pain. If you've got pain, back off. We're trying to help pain, not exacerbate it. So just keep that nice deep breath going. Keep that jaw in a relaxed position. And then you can reverse the circles and maybe come forward this time. Nice and gentle, but enough so that you feel it relax. And when you feel like that's got a good release, let's go right up to the temples. Your jaw muscles actually go right up into the head. So again, if you bite, you'll feel something pop out right up there at the temple. So again, just circles. This one you can add a little more pressure if you like. You can stand a little firmer pressure, and in fact, I really like that. But again, only the pressure that's right for you, no pain. Might feel a little bit sore, but it should feel good. Deep breath. Nice tall posture. That's very important for the jaw. And reverse those circles. You can go the other way. Because believe it or not, when we're hunched over and we have our necks forward and extended, our chins forward and extended, it places a lot of stress. That position places a lot of stress on the jaw. So we want to think about bringing our chins back in and our heads right on top of our spines. Really nice. So we're going to start with a little myofascial release. So you'll take your fingers and put them under your cheekbones. Feel your cheekbones. Get your fingers right underneath. And this is your masseter muscle, big, big chewing jaw muscle. Flatten out your hands, and we're just gonna let gravity take it. We're not gonna pull or force. We're just going to hang out and let the tissue release and let gravity take your arms down. So keep your jaw relaxed. You can open your mouth a little more. So it's hanging on that hinge. It's a hinge joint, right, the jaw. And just let it go. And I'm gonna be making some very funny faces in this video. So if you have to laugh, go ahead. It's probably good for the jaw. Laughter relaxes the body, so that's all good. Go ahead. Just let it take you down. Nice deep breathing. Relax those shoulders. Make sure they're not coming up with the hands. Back and down. And you'll go all the way down. Jawbone and the chin. If you want a little more intensity, if that was too light for you, you can use your fingertips instead of the flat hand. So you go right under that jawbone again, and then instead of flattening your hand, you'll just use the more pointed end of the fingertips. And if that's too much, go back to the flat hand, okay? So we'll do it again. Nice deep breath. And on the exhale, just let it hang out. This one feels nice for me. You might find one side is more sore than the other. Probably your chewing side. We all tend to chew on one side more than the other. We're chewing dominant. But it's normal. Excellent. Make sure that jaw is hanging out. Make sure those shoulders are back and down. Make sure you're sitting up straight and the jaw isn't jutting forward but coming in. And we're going to do a myofascial release the other way and then add some active movement. So first, we'll just do the plain myofascial release. So go to your jawbone under here, right on top of it. Just gather up that tissue there. And then you'll be, instead of going down, you'll be going up. So flatten out those fingers. And you'll be going upwards. Again, only as much pressure as is comfortable. And even though we're going counter to gravity now, you're still just letting the tissue soften and take you. You're not pushing up. It's just that trajectory. You're thinking going up, but letting the tissue release and take your hands. So it could take a really long time, and that's okay. That's the tissue warming, softening, releasing, and that's what you need. So go ahead up, relax jaw. Relax shoulders. The right side just got tender for me right there. Maybe I'll stop. If you feel a place that's a little tender or needs a little extra love, just stop and hang out there. Just apply a good amount of pressure so you feel a nice release, no pain. Take a deep breath in. Exhale out the tension, and then continue. And you can go all the way up. Remember, you've got those jaw muscles all the way up here. That feels really nice. Ah, heaven. When you've made it all the way to the top, if you want to add some intensity, we can add active movement. If that was intense enough, if that was good for you, just stick with that. But what we'll do is we'll start the same way. You go right on top of the jawbone, in and up, And this time you will very, very, very slowly begin to open your mouth. So, slowly letting your jaw drop. And you'll feel it stretch. You'll feel it counter stretch. And I probably look like that painting The Scream. You know, I'm doing some good faces on YouTube today. And when it's opened all the way, you can gently close and then do it over, do it again. I wonder if you can see my tonsils. They're huge. Every time I go to a new dentist, I scare them. I have monster tonsils. Just in case you were wondering. Oh boy. And just give that a nice massage, that whole masseter muscle. Again, good faces. Go forward, you can go backward, you can do anything you want. Just let that all turn to mush. Very good. Let's do our temporalis, that big jaw muscle that goes all the way around the ear. So you can start off here and work your way back and around. And again, if you bite your, clench your teeth or bite, you'll feel the muscle pop out right around here. Just go in around the ears. You can make circles. You can again stop if you feel a certain tenderness, or if something just feels really good in one place, hang out there, why not? That's what we want it to feel. So like behind the ear here, that all counts. That feels really good. Definitely could have some tender points there, I do. I'll just wait and breathe. Breathe in nutrients and healing energy and oxygen and goodness, and then breathe out the tension. Breathe out anything you don't need. And then continue exploring, looking for other places, or just giving it a nice massage. And then we'll just brush off to finish. Nice. And we'll end like we started with a nice deep breath in through the nose and out through the nose. Feel that belly expand. Feel the jaw relaxed. Long exhale. And I hope you're feeling a little better, the jaw more relaxed, less pain, and just the whole body too. I mean, when one part of the body is, tightening up, the rest responds, especially when it's right on your face, right? So I hope it's feeling nice and relaxed, and that it'll put you in a better mood. Because let me tell you, when my jaw's tight, kind of in a bad mood. I'm a little bit of a pip. So anyway, if you liked this, if it worked for you, do give me a like, subscribe to my channel because I have lots more coming out, and hit that notification bell so that you don't miss out on the latest self-care video. And I want to hear from you. Comment, let me know how this worked and what you want to see. I will see you soon.